So cystic fibrosis is a genetic disorder. And the genetic predisposition in terms of inheritance is what? Autosomal, recessive. When you say autosomal, how many pairs of your chromosomes do we have? 23 pairs of chromosomes. When you say autosomal, it affects the first 22 chromosomes. Any from that first up to 22 chromosomes. When you say X-linked, it affects what? The 23rd or the last pair of chromosomes. That's your X-linked or sex-linked inheritance. When you say recessive, you need to have like, if your gene is like recessive, you need to have a partner with the same gene to carry it in the next generation. And the carrying percentage is about 25% only. My classic example is being a blue-eyed person. For example, if I'm blue-eyed, my gene is like recessive gene. If my gene for being a blue-eyed person is only recessive, it's not dominant. The opposite is dominant. If it's recessive, I need to have a partner with at least recessive gene who has a blue eyes para ang anak namin, for us, for the next generation, to acquire a blue eye. But the thing is, it's only about 25%. Among the 4 kids that we will have, as long as I have recessive, as long as she has recessive, 25% will acquire that blue eyes. If it's dominant, for example, if it's dominant, I don't need a partner to have blue eyes as long as my blue eye is a dominant gene. I don't need a partner to transmit it to my 2 kids. Just imagine that you don't need another partner. That's being dominant because, again, your gene for being a blue-eyed person is dominant. You don't need a partner to transmit it to the next generation, and the next generation could have 50% of them will have blue eyes. So recessive, autosomal recessive, when you say autosomal again, first for 22 chromosomes. When you say sex-linked or X-linked, that's a 23rd chromosome. When you say recessive, 25%. You need to have another person to transmit the gene or the defect or the mutation. Autosomal recessive inheritance. We are talking about your CFTR gene. What's CFTR? When you say CFTR gene, there's a genetic mutation to the CFTR gene. Ano tong CFTR gene na to? Or cystic fibrosis transmembrane reductase. Of course, the NCLEX will not ask you, what is the meaning of this abbreviation? Transmembrane reductase receptor. What does it do? For example, if this is your cell, respiratory, these are your organs affected, but it doesn't only affect these organs. I'm just paying particular attention with the organs affected that are prone to complications. Respiratory, I'll put here GI and your repro. Maybe I'll just include your skin. So 1, 2, 3, 4. What does it do in your respiratory system? Remember yesterday, I told you about the mucosa and submucosa. Your mucosa is made up of what? Epithelial cells. And it's ciliated, right? The projection is upwards. At the bottom, this is your basement membrane and your smooth muscle, and then the very bottom is your mucinous cells, which continuously secretes mucus to what? To hydrate your cilia here. We call it as your mucociliary function because you need to put some mucus there to trap your particles, your foreign particles. For example, this is your epithelial cell. In your epithelial cell, normally you have a transport membrane which transport, what is this? This is your intracellular space, epithelial cells. Intracellular space. This white portion here represents your epithelial cells. I just didn't do the spiky things for the purpose of better understanding and better illustration as well. Intracellularly, this is intracellular and this is extracellular. This is extracellular here. So, what's the major electrolytes in your extracellular? Sodium, chloride. This is positive. This is chloride, negative. And your calcium. Forget about your calcium this time. This is not action potential. Forget about it. Intracellular, we have your potassium and your phosphate, negative, positive, and as well as your magnesium. Forget about potassium. Forget about phosphate. Forget about magnesium. But chloride is also present in a smaller amounts in your intracellular space. How about sodium? There are smaller amounts of your sodium here in your intracellular space. Maraming sodium dito because it's dominant in your extracellular space. And there's also sodium here. Chloride, I'm gonna write chloride as coarse. And dito, konti. May chloride din dyan. There's a little chloride on this portion. In your cystic fibrosis, normally, your chloride usually just exits here. It's a transmembrane channel. Ibig sabihin, on the cell membrane, they easily passes through this membrane. Going in, going out, going in, going out. What's gonna happen in your cystic fibrosis? What's gonna happen is that this chloride here will not be able to pass through because there's a genetic problem in this particular gene. In other words, it's deleted. Kumbaga, walang function. It's almost like deleted. It's there, but it's not. Parang ganun. Let's just say nandyan siya, but it's not working. In other words, this chloride here cannot pass through to go outside. Eventually, there's accumulation of chloride. Ang daming chloride. So, more concentrated than the extracellular space. What's gonna happen? Osmosis. Where's the osmosis here? From an area of lower concentration to to an area of higher concentration. Remember, there's a sodium channel. Your chloride and your sodium, they are friendly to each other. Of course, that's osmosis. From an area of a lower concentration into a higher concentration, they will pass through this membrane. And remember, this is semi-permeable as well. They will pass through that. So here is the sodium and chloride. What's going to happen on this area? Remember, that's sodium. Where sodium goes, water goes. So this one, this area here, without sodium, without chloride, without water, because where sodium goes, water goes, this is dehydrated. This will be dehydrated. What you see here is your what? Is your cilia. And what you normally see here is your mucus. So if this is not containing with water and sodium, this is going to be dehydrated. So this is going to be thick. Remember, that's water, that's diluent. So this is going to be thick. What's gonna happen is it's going to compress your cilia. So basically, there's a problem in your mucociliary function. Is your patient high risk for infection? Did you get the mechanism? Will your patient have a respiratory infection problem? Definitely. Okay, when you say cystic fibrosis, they are prone to what? They are prone to have infection, and a chronic infection that's usually associated with this cystic fibrosis is what? It's your bronchiectasis. Bronchiectasis is characterized by layered sputum. Layered sputum is like this. Dito sa baba, it's too much thick yellowish sputum. Ito naman sa middle, some kind of a bloody kind of a secretions. And here is a little whitish secretion. So that's layered, layer to layer. Okay? So that's layered sputum. That's characteristic of your, again, quote and quote, characteristic of your bronchiectasis present in your what? In your cystic fibrosis. So when you say bronchiectasis, again, this is usually blamed. This Pseudomonas is usually the culprit of this infection. If you're immunocompromised, Pseudomonas is there. So Pseudomonas. Think about NCLEX tobramycin. The drug of choice for this particular bronchiectasis found in your cystic fibrosis is your tobramycin. Is this a priority? That's why I made it as number 1, because it's a priority. It's an airway priority. These patients are usually managed with what? Management natin dito is your chest physiotherapy. Chest physiotherapy is actually respiratory therapist responsibility as your chest physiotherapy. This patient normally has a parang a vibrator dito sa chest and sa back. Normally it vibrates to promote chest physiotherapy to liquefy the secretions. Okay, nakasaksak yan. It's like a machine. It's like a pang ab former, something like that, but it's in the chest. Okay, or sometimes the back of the patient, hinihigaan ng pasyente. They lay on that particular gadget. That's chest physiotherapy. Common NCLEX question, blowing bubbles, because these are kids. Most commonly, of course, kids. Genetic yan. Since birth, they have this already. So kids, blowing bubbles. Don't forget the blowing bubbles. That's NCLEX tip. Blowing bubbles is a kind of play among these individuals to at least liquefy the secretion at the same time. Just like incentive spirometry, improve the overall lung compliance. So blowing bubbles. Yan. Pwede yan sa kanila. Of course, just physiotherapy. Antibiotics, as I've said, tobramycin. Just one of them. Okay, let's move on to your respiratory. It should be the GI. What's the mechanism in your GI? GI problem, particularly the pancreas, and I'll include the liver. This is your pancreas. This is your head of the pancreas, and this is your tail. So in here is your duct system. Duct system. This is where your pancreatic trypsin. This is where your lipase and amylase, remember that's a duct, passes through. Trypsin is necessary for what? Protein metabolism, to digest your protein. Lipase is for what? Of course, fats. Okay, amylase is for carbohydrates. Remember, anatomy, physiology. And of course, 99% of your pancreas is made up of your acinar cells. And the rest of it, like 1% is as an endocrine organ, like the insulin and the glucose kind of physiology. But anyway, we'll focus on this one. Trypsin is for digesting your protein. Lipase is the digestion of your fats. Amylase is your carbohydrates. This is your duct system. Once your pancreas secretes your trypsin, lipase, amylase, goes right here. For example, if you're eating your food, protein kind of food, so it's going to secrete more trypsin to go here, and then it travels here down to your what? To your duodenum for digestion. What's the problem in your cystic fibrosis? The problem in your cystic fibrosis is like this. It's your duct, and this is your ductal cells. Surrounding is your ductal cells. For example, this is your ductal cells here. Intracellular ductal cells, and this is your duct system or your extracellular space. Yan naman si CFTR. Deletion of that particular channels, chloride and sodium. It's the same thing. What's gonna happen is that it's not gonna go out from there into this portion. Same thing that will happen in just like your respiratory system. Chloride and your sodium with water. Since concentrated na dito by virtue of osmosis, your sodium and water goes here with the sodium channels. It's permeable, of course, and a chloride. So what's gonna happen is still this will dehydrated na naman duct system dito. So you think this trypsin, this lipase, and your amylase will be able to pass through this if you have like food here in your duodenum? No. That's why deficiencies of your what? The patient will have like failure to thrive, malnutrition. This is where your cystic fibrosis derive its name, right? You know why? Because when you say cystic, it will promote a fibrosis here. You say cystic, it's like a fluid-filled kind of a formation here. And then it's a chronic disorder, basically. So it will promote fibrosis or scarring of this particular portion here in your pancreas. That's why it's called cystic fibrosis. So it's derived from its pathophysiological mechanism from the pancreas, not in your respiratory system. It's just so happened that your respiratory system, mucociliary system is also like affected because it affects the whole body as well in general. So number one symptom natin dito is what? Malnutrition. Sa liver, it's the same thing that will happen. Same mechanism that will happen. Okay, malnutrition is, of course, you're talking about you not be able to digest your vitamin A, D, K. But these are fat-soluble vitamins. So I'll just say failure to thrive, malnutrition. So another thing that will happen here, if these fats are not digested from the liver, because your liver is what? Less bile. The same thing that will happen. Less bile, you're not be able to also digest your vitamin A, D, and K. So because bile is also needed in the emulsification of your fats. So if you look at your stool will be what? Will be bulky stool, steatorrhea. Or I just say like fatty stool. That's your steatorrhea. Fatty stool and a foul-smelling stool that contains fats. Among infants, the initial symptom of your infants is what? Meconium ileus. What does it mean when you say meconium ileus? Normally, infants will pass through their stool within 24 hours up to 48 hours. But after like one day, after like 2 days na, it's almost like 2 days, the infant is still not passing stool or the newborn because their stool is bulky. It's dehydrated. That's why they are not able to pass the stool. So that's a sign of your what? That's a sign of your cystic fibrosis among infants. Another thing, it's not really the pathognomonic because meconium ileus can also be found in patients with Hirschsprung's disease, megacolon, and then they're not able to pass a stool as well. So meconium ileus can be found in your cystic fibrosis and your Hirschsprung's disease. But again, it's a first sign of your cystic fibrosis among infants. What else here? So our management here is basically what? NCLEX common question is what? Is your supplement pancreatic enzymes. It comes in a pill, coated or a capsule. In the inside, there's your powdered kind of supplement or enzyme. You know what? Because we need to digest these kinds of nutrients. Of course, your protein, your carbohydrates, and your fats. Because you will not be able to digest or absorb your A, D, E, and K if you don't have your fats. You need that, right? If you're not be able to digest your fats, and then chances are vitamin A, D, and K deficiency. So most common concern about this pancreatic enzyme supplement: do not crush, do not chew, do not crush or chew. It should be sprinkled on an applesauce kasi your pancreatic enzymes do not thrive in they are easily digested in a alkaline environment. So applesauce is basically acidic. So if you know applesauce, it's not apple cider vinegar or something, that you will make it as a sauce. It's not. It's an applesauce. It's almost like a soft kind of diet. So it's different. What else pa ba? Pre and post, pre or with meals. Pre or before meals or with meals ang ano natin. And of course, not taken with milk. Remember, this is a kid. These are babies or these are young ones. Okay? It's not taken with milk because it may curd with milk. So you'll not be able to digest this medication or this supplement. These are the common things that are asked in your examination. These are your pancreatic enzymes. The diet should be what? Of course, high calorie, high protein, high lahat, high carbohydrates, and of course, and high fat diet. As long as you have the supplements, okay, that's okay. That will be able to aid in the digestion of these nutrients. And don't forget, since it's a genetic kind of problem, genetic counseling. Genetic counseling is also one important thing. And of course, remember in your respiratory, don't forget airway management. So what else? Sa skin naman natin, it's the same thing. What's the problem here is increased sweat with sodium and chloride. It's the problem, right? You know, this is stable salt, sodium chloride, remember. So just remember in your cystic fibrosis sweat chloride test, because they're gonna test your sweat chloride, your sweat for sodium and chloride. So what is this? Letter S, letter C, senior citizen, right? Senior citizen, the value is 60 milligram, I think it's milligram per deciliter. So what's a senior citizen? 60, diba? Just for you to remember it. Okay, if it's 60, if it's more than 60, that's what? That's a positive for sweat chloride test. Senior citizen, that is what? That is cystic fibrosis. Too much salt in the sweat. Again, this is something about sodium and chloride. So abnormal transportation and absorption of your sodium chloride, because your sodium chloride should need to stay in your what? Should need to be absorbed in your extracellular space, and abnormal disturbed transport of your chloride. So abnormal transport of your chloride, because you have lacking of your CFTR, it's genetically mutated, and abnormally absorbed sodium. So sodium should stay in your interstitium to hydrate a certain portion, for example, your duct system. Anyway, this is your cystic fibrosis.